Thank you. Good afternoon, Chairman Clyburn and members of the Select Subcommittee on the Coronavirus Crisis. I am honored and grateful for the opportunity to testify today. My name is Gina Forbes, and I'm here to share my experience as a parent and early childhood educator. I currently have a 13-year-old son and an almost 2-year-old daughter, and I've been working with young children and families for nearly 18 years. I'll begin today by sharing my experience of being an early childhood educator and past director of a child care center, and then share my experience of navigating the challenges of child care during the COVID-19 pandemic as a parent. From 2013 until June 2021, I worked at a program called Roots and Fruits Preschool in South Portland, Maine. I began as a teacher and was later hired as director in 2017. Roots and Fruits was nationally accredited and was of the highest quality rating. My own son attended at age 4, and I watched him thrive in the program. I was able to witness firsthand how high-quality early education can set children up for lifelong success. As director, I became very intimate with the joys and challenges of running a child care program. I was first and foremost committed to quality education for the children in our care. There was always a delicate balancing act of enrolling enough children to be financially successful while keeping prices affordable to families and assuring that there were not too many children enrolled for our standard of care. It was important to our organization that we serve a diverse array of families from a variety of backgrounds, including income levels. The business structure of our organization and in the field in general was set up so that the only way to address increased costs, including increasing staff wages, was to increase tuition rates for families. Keeping the cost of care accessible to families meant keeping wages at or below a certain level for staff. This lack of fair pay, inability to offer health and other benefits, and the high demands of the job is a recipe for teacher burnout, stress, and sometimes turnover. I'm sharing this information about pre-pandemic times because it has everything to do with the crisis we found ourselves in when March 2020 came around. In the initial first wave of COVID-19, we closed our school and remained closed until mid-June, when we had clear guidelines about how to run a child care program safely. When we finally had a reopening plan, it was at reduced enrollment, just over half of our usual functioning. To run the program, we had to raise tuition for families, and even this was not going to be enough. We projected a deficit for the year due to the loss associated with lower enrollment and the cost of additional safety materials and procedures. Thankfully, during the school year, we received a PPP loan and federal COVID relief funds that made it possible for us to run our program. These funds covered costs related to additional cleaning supplies, PPE, and helped cover the losses from our closure and lower enrollment. We were also able to give some additional bonuses to staff in lieu of hazard pay. Ultimately, these funds helped us significantly, but it was not enough to keep us open long term. With razor-thin margins and challenges present long before the pandemic, what we needed to be truly sustainable was a significant and committed long-term financial investment from state and federal funds. We could have chosen to continue to raise our tuition rates, but this would put our organization's values of offering care to diverse families at risk. It was for these reasons that I, along with our board of directors, decided to close the Roots and Fruits program, and in June 2021, I handed over the keys to the building and closed our doors permanently. As a parent, the impact of COVID-19 on the child care sector has been felt in very challenging ways. Since Roots and Fruits closed, I've had to find a new child care arrangement for my youngest child. We were able to find an amazing child care provider who offers local in-home care. However, it is only part-time, and it is far more expensive than we had budgeted for or can truly afford. We have inquired about other child care possibilities that would better fit our budget. However, every program we have spoken to has a wait list, and some for years to come. It is an understatement to say that it is a constant and persistent stress on me and my family to figure out how to afford high-quality child care. One small respite from this ongoing stress was receiving the monthly child tax credit payments, which went directly toward child care costs. Without them, I am struggling to figure out if I can continue to work or if I need to remove myself from the workforce to care for our young child. I can't help but be reminded that child care workers are truly the workforce behind the workforce. The issues that I described today are not new, but are built into the child care system as it has existed for many years. The pandemic has significantly exacerbated those issues. High-quality early education and care is the backbone of our society, and I believe that we need to fund it accordingly. Our children, families, and educators deserve nothing less.